Hi everyone, I'm Dr. Tony Blau. I'm a hematologist. I have a form of blood cancer called multiple myeloma, and I started All4Cure to help patients like me. What follows is a brief explanation of today's topic, and then listen in as the All4Cure team discusses the real-life situation confronting one of our patients. Use the comment section to weigh in with your own thoughts or to suggest topics for future videos. And thanks for watching.
If you've had a stem cell transplant and you see your myeloma markers on the rise again, you might be a little worried. Well, you shouldn't be scared because there are many different treatment options that are still available for you. You and your doctor could consider joining a clinical trial. Some examples of those are CAR T-cell trial or a BiTE trial. You and your doctor can also consider adding prior treatment. Let's say you're on Revlimid maintenance and you've taken Decadron and Velcade before. You can start the 3-drug regimen again. You could also start a new drug regimen. There are many different treatment options like Darzalex, Kyprolis, Pomalyst, and Nenlaro. All of these options may get your myeloma under control and have you feeling great again. If you would like to see the virtual rounds that were behind the making of this animation, please keep watching.
Think about what's going on now and what changes or additions to treatment might be worth considering now based on what's going on.
I would think changing things up because even after his stem cell transplant, his monoclonal protein was never zero, and it is on the rise.
Yeah,
So
it looks like it's on a pretty steep incline,
yeah,
and he's super young. He has a history of hypertension, did you say, Jane?
yes,
And yeah, I share the concern about the rise in his M protein during such a short period of time following his autologous stem cell transplant. There is that earlier intervention with CAR T cells for people that have relapsed within a year post autologous stem cell transplant. And so that would definitely be one thing I would keep in mind. And it would be useful to know whether there are clinical trials that have kind of well, it'd be good in general to know what are the clinical trials for multiple myeloma that are available through OHSU, and look at those and see whether there's something that could be worth thinking about for this patient. He's had, relatively little exposure to a 3-drug combination of bortezomib, Revlimid, and Decadron. Single agent maintenance therapy with Revlimid doesn't seem to be keeping things under very good control. But I think changing things up would be good. Clinically, his disease is acting like it's, quite aggressive. And on the other hand, it was responsive to a 3-drug regimen here. He was on it for a relatively short period of time. Now he's been on one of those drugs and it's still going up. So one approach would be to add back Velcade and Decadron and see if you can knock this down again. I'm not super optimistic that will have the desired effect because he's received these drugs before. He's continuing to receive this drug. So would adding Velcade and Decadron knock it down? It might, and I wouldn't discount that possibility, certainly. And so I think that would be one thing that you could do is go back on 3 drugs and see if you can knock that down more, as it worked the first time. Alternatively, you could switch to other 3-drug regimens. Obviously, a 3-drug regimen that a number of our patients have gotten in this kind of situation is carfilzomib, pomalidomide, dexamethasone. We've seen that work reasonably well, quite well, sometimes in this situation. So switching to carpom dex is an option. That's a It's a very expensive combination of drugs. Another expensive combination of drugs would be daratumumab, daratumumab, Velcade, Dex, daratumumab, carfilzomib, Dex, daratumumab, pomalidomide, Dex. So, but I think a 3-drug regimen is going to be important. I think get it to try to knock this down. Ideally, in my ideal world, it would involve 3 drugs that he hasn't received so far to have, I think, I would guess, the best chance of bringing this back under control. All of those are really expensive routes to take, but I think, that each of those would have a reasonably good chance of bringing this back under control. I think an early intervention CAR T-cell trial would be very interesting. Other clinical trials involving BiTEs or BCMA targeted agents would be really interesting to get teed up for treatment. Now he could try, an all oral regimen. He could try to add an Enlaro and dexamethasone and see if this can knock it down. And with the advent of COVID-19, there's a big push to move to by oncologists now to use Enlaro more than Velcade. And I've just seen that Enlaro sales have really gone up in the last 2 or 3 weeks to keep patients out of the clinic. So they take pills, and it's even being used now as frontline therapy instead of RVD, NRD to keep people out of the hospital. So it's had a dramatic, I think, from what I can tell, a dramatic effect on the way that myeloma is being treated to accommodate. So he could try that, but I think he's going to need more urgent attention. He's going to need more frequent visits. Certainly, if he goes to any of these other treatments that I've described, they're all going to require much more frequent hospital visits.